Hi, I'm Dan Major, and I'm here for Life the Basic Manual. And I'm going to talk with you today about addiction and chronic pain as co-occurring disorders and get into pathways of recovery for both of these compelling and complicating conditions. Addiction and chronic pain by themselves are pernicious and really difficult to treat disorders. They wreak havoc in people's lives, turning them upside down and inside out. But when they're combined, when they co-occur together, they're even more complicated and more difficult to sort out and to recover from. They tend to take over people's lives, making their worlds smaller and smaller as the focus of their thinking, their feelings, and their day-to-day activity increasingly centers around the need to feed their addiction and find relief from the continuous pain that they experience. Chronic pain is very different from acute pain in that acute pain serves a purpose. It's related to a specific time-limited injury or illness. It gets better within several days or a handful of weeks. The condition that causes the pain heals, and the pain serves the purpose of sending a signal that there is something wrong. Chronic pain is very different in that it's pain that lasts at least 3 months, usually 6 months, and often continues for years. And it's wearying along the lines of a smoke detector whose alarm continuously sounds, and there's no way to turn it off, even though it serves no useful purpose. There's no smoke, there's no fire, there's no actual reason for it to be on, but yet it continues to sound this harrowing alarm. So as it relates to addiction and chronic pain, they tend to co-occur because people with chronic pain conditions are prescribed opioid pain medications, typically, as the first line of treatment. And one of the things that's happened is that that's led directly to this phenomenal epidemic of opioid abuse and addiction, especially in the United States, where in 2014 alone, according to the Centers for Disease Control, there were over 16,000 overdose deaths specific to opioid painkillers. So what happens is people get prescribed opioids for chronic pain condition, and they end up overusing them, becoming physically dependent and ultimately addicted to them where they need them. It's not just about relief from the pain, it's about continuing to feed the body's increasing and continuing need to feel better, to feel relief, not just from the chronic pain itself, but then to stave off withdrawals that the medication creates. Also, there are people who are already addicted, who end up with chronic pain conditions, who take the pain medication, and it just becomes part and parcel of an ongoing addiction. And then, of course, there are also people who are in recovery, sometimes for long periods of time, who unfortunately end up with chronic pain conditions, especially as they age and the body breaks down, deteriorates in various ways, or they get hurt, and they're prescribed opioid pain medication and fall prey to relapsing on that medication and end up in active addiction again. In our next segment, I'll talk to you more specifically about pathways to recovery from these really insidious conditions.